Hi everyone, welcome to Fast Intelligent Care. In our next few episodes, we're going to be doing an interview with Natasha Nutt, the Director, Occupational Therapist, Manual Handling Consultant, and Trainer of Movementum. Thank you, Natasha, for joining us today. We're going to do a four-part series. So this is our part one, where we'll go into a little bit of your background and how Movementum started. So first thing I want to ask is if you can tell us a little bit about how you actually got into OT. What was your journey into OT?
Thank you so much, Chanelle. Thank you for having me here.
You.
I'm excited to be here and be able to be talking through all of this. So, wow, if I think back of what got me into OT, that was now 25 years ago. So I did actually go straight from high school into OT. And I think for me, when I was looking at what career path, it really was just as simple as I knew I wanted to help people. And I was originally thinking that I'd potentially go into physio, ended up in OT, and really never looked back. For me, it has always been about a connection to people and to their lives, and then looking at how I can partner with them to help them achieve what it is that's important to them. So, really, OT was a perfect fit. And it has evolved so much over the years from what I was doing 25 years ago to now, but that still remains the core of what got me here and what keeps me here.
And how did
Um,
you get into manual handling training, or how did Movementum start?
yeah, great question in terms of all the things that you can do in OT. How did I land in manual handling? Um, Probably for me, it was really around a love for community care. So once I graduated, I worked in a number of roles and eventually ended up overseas. And while I was working in Dublin, I really fell in love with community care and being able to work with people in their own home environments. And it really had me realize how seeing being invited into that environment to be with people in their home, see the realities of their home environment, their family, what it is they need to achieve in the day, really opened my eyes to just how much I wanted to be in that space to help me get the most of what could be achieved for individuals. And when I was coming back to Australia, then after that role, I had applied for a position with DADC at the time, Department of Aging, Disability and Home Care, in their manual handling unit. And that was such an incredible experience. I was there for over 7 years and really was employed into a role where I was tasked with ensuring that care services that were happening in people's homes in the community were high quality, but also that were safe for the carers going in, because I was employed by the department that was actually employing the care providers. So it really was a work health and safety position to make sure that support workers were safe and that they were delivering that care. So I had some incredible training over that time with the Masters in Manual Handling. So Anne Adams, Kylie Downs, Sarah Thomas, just an incredible crew there that ignited my love and passion for manual handling and made me realise how creative and powerful it can be in terms of what someone's care looks like. So that really kick-started manual handling for me.
Oh, that's lovely. And how does Movementum today support people? Is it focused mostly on the support workers, or is there does Movementum support OTs as well?
So it's really changed over the years. So after that role with the manual handling unit, I then went and got a qualification in work health and safety, and that led me to create my own business, which is Movementum. So the whole reason for creating Movementum is I could see the need for support in that environment of providing care in a home environment, which is not designed for care, but becomes the space where care happens. And so for Movementum, it's really around that care ecosystem, what it looks like in someone's home, and then supporting anyone involved in that. So the work we do now still is working with individuals who are NDIS participants and have complex physical disabilities. But then, yes, we work with their care providers, support workers, the clinicians that are involved in that space, equipment suppliers that are involved. So, and of course, families. So anyone that's in that care space is where we are involved now. So that can be through risk assessments, through training. We do quite a bit of training for care providers to make sure that their staff have those foundational skills that they need to go in and deliver complex physical care. We are also growing more in how we support families, because families take on such a huge role in providing care, and often without any training, and they've just had to just make it work over the years, and very much learning on the job. So growing in how we support families, and also a lot of work with therapists who have such a broad scope a lot of the time now across NDIS and aged care. So we can come in and help support therapists in some of those moving and handling challenges. That's pretty diverse.
Yeah, and it's good. I think the word they use, like that support ecosystem, is actually like with manual handling. It is so like you need to look at it so holistically, because you can have the right equipment in place, but then the support workers aren't confident using it, or like you said, a lot of times it's family members doing it, so they don't have any healthcare background, so they don't have that training necessarily. And then I know with OTs, from what I've seen as a clinical educator, there's a lot of fear with manual handling in terms of not really knowing exactly what our role is. A lot of OTs aren't sure if they're the ones that are supposed to be training the support workers, or if the support workers need to be trained by their agency, or whether it's only our role for the family members to be trained. And then also not knowing when to choose the right what is the right equipment. So there's a lot of support needed in that space, and it's great that Movementum is providing a lot of support with that. So I thought a good question that I think a lot of OTs would want to know is, what is the role of an OT when it comes to manual handling?
Yeah, absolutely. And I think as OTs, I agree that there can be fear around that and a hesitation to get involved in that space, but it is so fundamental to our role. And I feel like we have incredible skills that
Yeah.
has us well placed to provide support in terms of manual handling. So you are right, there is a distinction there in terms of the training of support workers. And I think we can get hung up on that a little bit, in that yes, under work health and safety legislation, the employer of those support workers does have a duty to make sure that they are trained in what they're providing. So those foundational skills should be provided by the care provider in that organisation. But when we go in and we assess a care routine, we assess a service and someone's functional capacity and their home environment, and then are recommending equipment or changes in routine, we are also then prescribing how that care looks like. As soon
Yes.
as we make any change, we are changing what that provision of care looks like. So it is important then that we are involved in and making sure that if we are making any change there, how is that actually going to look day to day? And that's where manual handling really is at the heart of that. And as OTs, we do assess an individual's function and their equipment and their environment, but we also understand people well, and that art of doing, and what it takes in your body to be able to carry a task out. So it is that, I feel like for OT, it's that perfect partnership between having a really good understanding of what a client is capable of and their whole environment around that, but also needing to have an understanding of what does it take in my body to actually roll someone now on this bed, and what's it going to take to fit this sling, and then look at how can I do that as safely and sustainably as possible. So OTs have such a great role there. And my encouragement would be to build your skill in this area. It's just practice. It's feeling like you can get in, touch the slings, use the hoist, actually have a go, practice fitting it. And if you feel uncomfortable in doing it, well, then how can we be expecting a support worker to be able to do it that is going to have time pressures associated, that is going to be doing it across all times of day with different levels of function? So for therapists in the manual handling space, I think, yes, we do have the skills. We are part of that care system. If we are prescribing equipment, we're also prescribing how to use, and it just takes getting in and having a go, having a practice, building those skills to find what is the safest, most efficient way that this can be done. And that will differ across every routine. It's not like it
Yeah.
is not black and white. There is so many shades of grey
Yeah.
in manual handling, and that's what I love. It is creative solution finding with
Yeah.
each individual and their routine, but we have great skills in that.
Yeah, I remember when I wanted to like upskill myself a little bit with manual handling, and I was looking at like best way to apply a sling, and I just saw so many like YouTube videos, especially with in the UK. They've done quite a lot on manual handling, and
Yes.
like this, like what's that saying? Like so many ways to skin a cat. There's so many
Yeah.
ways, like
So
thin,
many ways to fit a sling. Yeah,
slide sheet, different slide sheet methods. So yeah, like you said, like it's not going to be the same for every person. So it's good to, in a way, I think it's good to continuously look at what is the techniques that are out there, because one technique might work for this client, but not for another one. And I feel like
absolutely.
those resources are really good that are out there.
And
Do you have
also, the
any?
greatest resource, I was just going to say there, the greatest resource we have in a care routine really is the individual themselves and their carers. So I find I'm constantly learning, and there's so many iterations of how things can look because different people have strengths in different areas. And if we really find out what is that person able to do, for example, when it comes to fitting a sling, and we
Yeah,
use their capacity to the greatest level and then partner that with what the support worker feels comfortable to do, that's where I feel like we get the greatest outcomes.
yes. Do you have any like a story of how something that you've done with a movement and that has really made an impact in someone's life?
Oh my goodness, so many.
That's wonderful.
So many things that, have an impact on someone's life. I think probably one of the greatest things is if you can support someone to be able to remain at home for as long as is meaningful and important to them. Um, and I think in particular for one family who they really were faced with the reality that the care needs were increasing. The care provider was needing to put in two staff to be able to complete a transfer. But the family knew that they couldn't afford to fund the difference in this person's aged care plan on what it would take to move from one carer to two. So being able to then go in and work with that family and understand what their motivation was, because there was a lot of fear and anger around the fact that the care provider was making this change and that they
Yeah,
were putting in two people. But once you come to understand, well, what is underlying that? Why are they so frustrated about the need for two staff? And that when you realize that reality, that that's going to cost a lot more, it's going to mean they can't keep mum at home. So
yeah,
being able to implement a piece of equipment, which in that situation was a standing lifter, that their mum was able to use effectively, we were able to keep it to one staff member. That has allowed that particular woman to stay in her home still now than that was 18 months ago.
yeah,
And we have regular reviews to make sure she can still use it. But I think in that situation, you just see that once you understand what's underlying, what are the motivations, what are the underlying goals, and we can use equipment effectively, partner with well-trained staff and families, and you can get a great outcome that helps
yeah.
someone to achieve what they're wanting to. So
That
there's
is so.
always lots of great stories.
I like that I mentioned that, because it's something that I have heard a lot of OTs ask about is how do they bring in all this equipment, all this change into the home, because a lot of times there is a bit of resistance. Sorry, there's a little bit of resistance to um, any change within the care routine or change in equipment,
Mm,
especially when you start going towards full hoisting or passive hoisting. A lot of people, they still want to be able to participate in their manual handling or their care routine. They don't
absolutely.
want to have, I guess, they still want to have that ability to participate in it, have some independence.
Mm,
And I think I like that you said like you have to look at what is the goals, what is the fears, what's that thing that's underlying, and it kind
yeah.
of helps you to approach it whether it's like I want to stay in the home, or the fear is increased cost, or like you said, now I have to have two carers instead of one. So I love that you mentioned that. Do you have any tips for OTs that do struggle with bringing in changes, whether it's equipment or more support work is needed, how to approach that with the family or with the client?
Yeah, absolutely. And exactly as you were just touching on there with that term resistance. So it is something that comes up a lot, that we can complete an assessment, make recommendations, but there is resistance there, either from the client themselves or from their family. For me, I really have found over the years that when I look at where there has been that resistance as such, the underlying emotion that I feel like primarily lives under that is grief.
Yeah.
And it's that there's change. And for those that we're working with, when we want to introduce equipment, that to them can be like this concrete marker in time where they feel like things are changing and they're not going back to, we can't stay where we are, or we're not going back to where we were. So I think when we recognize the real humanness in that and the emotion in what it is like when we make a recommendation that fundamentally is going to change the way care looks in someone's home, there is grief. But that's, again, whereas OTs, we have that skill that we need to recognize that and open that conversation. And I think if we can really spend some time to get to know from a family and an individual, what are they wanting to achieve, what's important to them, and acknowledge the grief, acknowledge that this is hard, acknowledge that things are changing, but that there's still going to be options and opportunities in that to look at, well, how can we partner with equipment? And we have such an incredible range of equipment options now that it doesn't need to feel like we're going, this is the only option. So a recommendation for therapists would be that, yes, we need to have the tough conversations. We need to be open to discussing that grief and that loss, but then really pointing to, we have options here that you can test and try that can help maximize your capacity with where they're at.
Yes. And do you get to a point where, let's say, a client has completely refused a change in that routine, or change in their manual handling plan, where you have to continue on as the way things are, but there's now a risk to the support worker or the carers? How do you
Yeah,
approach that? I guess the client does have that choice, but we still want to protect the
yeah,
carer.
absolutely. And that's where choice and control comes in, and also dignity of risk. And so, yes, absolutely, an individual has the right to make a decision that may place them at risk. But what we need to realize is that people can't make a decision that will put a support worker at risk. And there is a difference there. So I have had situations where what the family choose to do and the way the routine looks with them, and we establish that, and that needs to look one way, where they've decided that, for example, they're not going to use the lifter.
Okay.
But needing to be really open that when for them to have support workers come into their home, that is not an option. And so we're going to need to have two options for what care look like. That is what the family wish to do for a period of time, but this is what it needs to look like for you to be able to have care come in, because we have to, under work health and safety legislation, we have to make sure that support workers can deliver a routine safely. And so that takes, again, having that open, honest conversation around what the boundaries are, and finding an option that still keeps that individual receiving the care they need, but in a way that it is safe and sustainable for someone to come in and do.
Yeah, I
So
love that you.
sometimes it does mean two options.
Yes, no, that's actually really good. I've actually once had that happen as well with clients of mine, where the family were very happy to pick up the client because they were a young 12-year-old boy, but as he was getting older and getting heavier, the reality was that was not something that we could continue with, especially with support workers. So
Absolutely.
that was the way that we also managed to bring in equipment, and when they got more familiar with the equipment during the trial process, they actually started seeing the benefit of it.
Yeah.
So that was almost a way to indirectly, like, wasn't the idea wasn't to change their mind, but they actually ended up seeing, oh, actually it's so much easier. I'm like,
And that's where having the ability to hire equipment is so valuable, because it means then that a family can have greater time with it, more exposure, they can see it being used, whether they're using it or not. And it hasn't felt like a commitment that this is what we have to do and that
yeah,
they've had that choice taken away. So having that extended opportunity to try equipment by hiring it for a period of time can be really effective.
yeah. I think it like yeah, the having time to get used to it. It's I guess it does help with that grief process as well. That
Yeah.
it's not just this immediate change from one day to the other. That it's a gradual change, somewhat in some sense.
And people can also have had experiences with equipment, say, for example, if they've been in hospital for a period of time, that is the frame, that's the lens they're looking at that experience of a lifter, for example. Whereas once it's in their home, it's being hired, there's been that extended time to be able to actually experience it and see how it works.
Yeah.
That can help to break down some of those barriers as well. Yeah.
Yeah, no, I think that's great to have that approach. And thank you so much for your great advice. We're going to go on to our part two episode, which will actually go a little bit into single-handed care, which I'm very excited to talk to you about because I've seen a lot of interest in that, and also a little bit of what the future of manual handling might look like.